The candidates for the 147th Missouri State Representative District in the November 4, 2014 election will be Gary Gaines of the Democratic Party, Kathy Swan of the Republican Party, and Greg Talapik of the Libertarian Party. Each candidate will have 3 minutes to make an opening statement, and we will begin with Mr. Gary Gaines.
Thank you. I too want to thank the League of Women Voters and KRCU for making this forum possible. I want to thank all of you for coming out tonight, and especially the ones in the room now. You stayed. You didn't leave after the federal guys. Thank you. Okay. I want to use my 3 minutes to tell a little bit about myself and some of my basic beliefs. I'm a graduate engineer. I have 3 engineering degrees from the university up at Rolla. I'm an Army veteran. After college and the military, I went to work for a small consulting engineering firm in my hometown of Dexter, about 10 employees. I really loved it. I really learned a lot about small business there. I eventually became a partner and 1/3 owner, and that experience in the private sector really taught me a lot about the challenges that face small business. After 16 years there, I wanted more challenges, and I was fortunate enough to get a job with the Missouri Department of Natural Resources as an environmental engineer. Wonderful job, and after a few years, I was fortunate enough to be promoted to director of the Southeast Regional Office at Poplar Bluff of the Missouri Department of Natural Resources. I learned a lot about government there. I was just a mid-level manager. There were 2 levels above me, but I was high enough to see somewhat how government worked, the budgetary process, the personnel problems it's faced. I learned a lot about government in general. It was really a good experience. During that time, I served on my local school board for 12 years. For 4 years, I was president of the school board. And I retired from DNR about 2 years ago. And now I volunteer. I volunteer at St. Francis Hospital on Monday and Thursday mornings, and I volunteer at Southeast Hospital on Wednesday afternoons. Some of my basic beliefs are as follows. I believe that educating our kids is the most important thing we do as a society. I've believed that for a long time. That's part of what motivated me to run for the school board. If we educate our kids well, they will do well, our country will do well. To me, it's very simple. I'm a fiscal conservative and a social moderate. By fiscal conservative, I mean I believe in balanced budgets and sustainable programs. I believe the biggest problem facing our nation today is the federal deficit, but I'll have to leave that solution to the folks that's already left the room. By social moderate, I mean I believe in women's rights, minority rights, gay rights. I'm real big on individual rights. I even believe in gun owner rights, although I don't feel the need to have my picture made with a shotgun in my hand. In closing, I'd like to say that I have the time, the desire, and the experience to be a good state representative. I'm retired. Other than my volunteer work and doing what my wife says, I have a lot of time. I certainly have the desire, and I believe my background in the private sector, government, and education gives me the experience. Thank you.
Kathy Swan.
Yes, thank you, Dr. Nickel. Good evening, ladies and gentlemen. Thank you to the League of Women Voters and to KRCU for hosting the forum this evening. I'm Kathy Swan, native of Cape Girardeau, born at St. Francis, lived on Adelina Pacific Streets, went to Franklin Elma Schroeder, Lorimer Junior High, graduated from Central, grew up in a small family business in town, majored in nursing at Southeast. I've been blessed with the opportunity to wear many hats: nurse, university faculty member, small business owner, school board member, city council member, board member of various state and local groups for business, education, and volunteer service, married to my business partner for 43 years, mother of 2, grandmother of 3, church musician for 46 years, and breast cancer survivor for 5. For the past 2 years, I've put this medley of experience to work in the Missouri House, serving on 7 active committees in key 3 areas: business, healthcare, and education. To ensure a fair, level playing field for small businesses, I filed bills regarding prevailing wage rates and business license renewals. And based upon the local impact of Gone Girl, I also sponsored a bill to extend the sunset on the film tax credit program. All 3 bills easily passed out of committee hearings. My nurse practitioner telehealth bill language that became law last year will increase access to health care in rural areas of our state, allowing nurse practitioners to expand their practice beyond the mileage restriction to provide health care to those in need. My early childhood education bill will allow school districts with preschool programs to begin receiving some state funding. Children who enter kindergarten not ready to learn are already behind, and they may never catch up. Two of my bills address needs for high school students, one to complete remedial education and another to increase college credit through the use of online learning. Both are important to student success. They save time and money. Safeguarding our dollars, I supported the bill for a modest income tax cut and sponsored a tax credit reform bill to start the dialogue for an evaluation of our tax credit program. A review of current tax structure and state budget is also needed. State government can and should be accountable. As a sponsor of a bill requiring annual health inspections of abortion clinics, I believe that every Missourian deserves high-quality health care, regardless of facility, procedure, or gender. Other bills regarding disabled veterans, birth certificates for adoptees, and music therapy have been based on your knowledge, expertise, and input. Perhaps the most valuable experience I've ever gained over the years is not about healthcare or education or even a lifetime being in business. It's simply about working with people and getting things done. Knowing how to successfully tackle difficult subjects with others who hold opposing views is an asset, a vital asset in the legislature. For this reason, my early childhood bill passed with overwhelming support. I'm off to a running start. Even though I must climb a flight of stairs to my office, it doesn't slow me down. I look forward to continue running at full speed as your state representative. Thank you.
Your opening statement, Mr. Talapi.
Thank you, Dr. Nickel. I don't know how much you all had to pay to get in here tonight, but I hope to give you your money's worth. I have 3 takeaways for you tonight. The first is on voting. And when people vote for the State House of Representatives, we really shouldn't be voting for an individual candidate. We should be voting for a political party to represent us. And that concept is called proportional representation. My second takeaway is healthcare. We need to deregulate healthcare and deregulate healthcare and deregulate healthcare until Missouri is the mecca for people who are looking for a place to get or provide health care. And the third is on education. And there's just no way around it. We need to start charging tuition for public schools. I'm kind of the canary in that coal mine. I hope I come out alive. It is good to be in a group of people who are interested in politics, especially since I am one of only 3 of you who gets to talk. I really do appreciate the League of Women Voters, sincerely, because you always invite all the candidates when you host a candidate forum. And I went to your website where I found beneath your logo a tagline which reads, "Making Democracy Work." And I care very much about that. I've been beating my head against that particular wall for the past 35 years. And to that end, given that Jefferson City is set up for political parties, and that the Libertarian Party is one of those parties, it is an officially established political party by the state of Missouri, has been since 1992, and solving for how do you make democracy work, I propose that the General Assembly implement a system called proportional representation. Take it home, Google it, you won't have a hard time figuring it out. And basically, it's just a system whereby if 15% of the people vote Libertarian, then we get 15% of the seats in the State House of Representatives. And it's not just for Libertarians, it's for you, if you're a Democrat in Cape Girardeau, or a Republican in St. Louis, where when you go to vote in November, if you're voting for the State House of Representatives, you might as well just stay home because your vote is wasted. It's not going to count for anything. And in fact, it is unfortunately true that for half of the people in Missouri, when they show up to vote for State House, they will find one name on the ballot. Half the people in Missouri, if they still bother to vote. Well, we can do democracy better than that. If you want to make democracy work, you can't just count every vote. You have to make every vote count. And proportional representation is the way to do that. And education and healthcare comments are going to have to wait till the close. Thank you very much.
We will turn to the questions now, and it's interesting that we have 3 questions, all of which ask the candidates whether they favor the legalization of medical marijuana sale and use in the state of Missouri. So let's begin with Mr. Gaines.
I have thought about this some in the past because there's quite a bit of discussion about it nationwide. And I guess I would have to say that no, I do not favor it. I fear that it is a gateway drug. I've tried to read up on it and try to understand it. And I think I would rather err on the side of caution as far as our young children are concerned. So I would have to say no, I would not favor the legalization of marijuana.
Last session, we did pass a bill regarding CBD oil, which is hemp extract oil, and for the use primarily for documented intractable epilepsy, particularly in children that respond to no other treatment other than that. At this time, that's the limitation that I'm willing to go to. I agree as well that it is a gateway drug. We have become, Southeast Missouri particularly, one of the meth capitals of the world, so therefore it's not a risk that I'm willing to take. We have issues with not having a prescription drug database as well. Thank you.
I kind of view this as a bonus issue. I'll call it the hot potato parable that I will give you in order to help it make it more memorable to you, besides the 3 takeaway points that I hope you take home with you tonight. I remember when I was young and I was trying to do the right thing, my mom telling me that if you don't want to do something, blame it on me. Well, in this case, I think we need to let the politicians in Jefferson City pass this political hot potato off to the voters and just put it on the ballot for us. This is, I think, one of a raft of items, civil liberties items, which I think we can't really expect our legislators to have the courage to address. But people, they're not complicated issues. We just need to let people decide them because they already have an opinion. I would say marijuana, red light cameras, license plate scanning, random stops, 18-year-old drinking, surveillance drones, the death penalty, militarization of the police, and the list goes on.
All right, we will turn now to a question about how would you, as a representative, make health care more available and affordable to Missouri's presently uninsured citizens?
We've had several discussions over the last year. Last summer there was an interim committee on Medicaid, and there are opposing opinions on both sides of the issue. One of the issues, there's a demographic, a couple of demographics that do not have coverage. One are young men, single young men. Another are those labeled as the working poor. There are those who would have approved of receiving some Medicaid dollars knowing that the percentage of the federal government payment on those would decline over time, but were willing to institute measures that would take care of that situation, and as the dollars would decrease, as far as coverage would not continue at that point. Working poor, we do need to address. Those individuals are working for an employer or working a number of hours where they do not have coverage. That's a problem. We also need transformation in the benefits and incentives to reduce health care costs.
This question seems to skirt the hot topic on the agenda in most newspapers is the Medicaid expansion. And I would say that it's probably not a bad idea to expand Medicaid for a while, to provide a window of opportunity for people, so long as it is possible, to make them aware that that they've got just a short time to get their medical issues taken care of. Other than that, I said one of my takeaway issues was the deregulation of the healthcare industry. Deregulation of healthcare will float all boats. Healthcare is one of those monopolies. We get the same result as we do from the education monopoly. We get expensive healthcare and not enough choice. Regulation protects some and hurts others. The people being regulated want to be regulated. It's well-intentioned, but it reduces supply. And we either have to increase the supply or we have to decrease the demand. And for most of us, many of our medical needs are routine. Take, for example, a urinary tract infection. We really need, I don't have time, that we need to introduce some competition to health care.
I would expand Medicaid. I think that should be expanded to cover the folks that's not covered. Take the federal funds and deal with it. When the funds run out, find another way of funding it. But I think the bigger question is what Kathy and Greg touched on, is deregulations. It's what else do we buy without knowing the cost, and we pay for without knowing what the bill is? That just baffles me. You get a bill after 6 months, after you've had a procedure, after it's been to the insurance companies and the providers and 14 other people to tell you what your share is. How do you do business that way? How do you bring competition that way? We need to relook at the way the medical system operates and find a more efficient and more productive way of operating it. And I'm not knocking, as I said, I volunteer at both hospitals. I have a tremendous amount of respect for medical people. They're dedicated, hardworking professionals. But the way the system is set up, it's too expensive, it doesn't work well.
Okay, the next question. When comparing Missouri's income tax with that of other states, would you consider it high, low, or average? And what changes, if any, would you advocate in our state tax laws? Mr. Talapi.
I don't know what the surrounding states are. I suspect that we are lower than Illinois, and I think that, I'm just generally opposed to taxes, and I'm not in favor of a flat tax or a fair tax. I'm sorry, I can't really think of a good answer for this. I think we just really need to reduce government expenditures, and I would be in favor of some kind of a balanced budget proposal so that Congress, the legislature, can't spend more money than they have. And we really need to get the economy going so that tax revenue is not the issue.
I think we're probably one of the lower income tax states, the lower rate. As Greg said, I'm not for sure either, but just judging by other things that I see in the state budget, we have to have enough tax to support the services and the protections that we need. And I'm not a tax and spend liberal. I'm truly not. As I said, I'm a fiscal conservative. If you don't believe it, just ask my wife. But I believe we have to have enough taxes. I'll use Cottonwood as an example, a focal point that came to light here in Cape Girardeau. When you cut taxes, and then the governor cuts the budget, and then you get to finger pointing, and things suffer. We lose services. We lose badly needed services. We should always be frugal. We should always look for the most efficient way and bang for the buck, whether it's government or not. But we do have to have certain basic services, and those services cost money.
Last session, we attempted to pass an income tax bill, and we were successful this session with an override the first part of May, and it was a modest individual income tax cut along with a business cut that would be phased in. Where we differed from Kansas, Kansas did not have a trigger. We learned from Kansas, and we have a $150 million trigger that must be met over the previous 3 fiscal years before the next phase implementation begins. Tax-wise, it depends on who you talk to. Some individuals feel we're a very high tax state, others feel we are a very low tax state. From the first time that I ran, I thought we needed to turn the whole tax system upside down along with the tax credit program plus the sales tax, take a very hard, intensive, analytical look and approach to restructuring the entire tax system.
We have another question about the economy. How would you address our weak economy in the state of Missouri?
How come I have to answer this first? No. That's a tough question. We need to do things to stimulate the economy. If I'm elected to the legislature, I would propose putting on a ballot a fuel tax to fund transportation infrastructure. I voted against the sales tax because I didn't think that was a proper way to fund transportation infrastructure. But I recognize that we must have a modern, well-maintained transportation system for our economy to thrive. And by doing that, it would pump hundreds of millions of dollars into the economy, and it would build infrastructure that we truly need. You know, the general comments, we need to tighten our belt, we need to look at all the government regulations, all that kind of stuff that nobody knows what means. But we should always be mindful that it's the taxpayers' money and it should be spent wisely.
During a seminar this summer on economic development that I attended, there was a listing, and we've heard this before, of items that businesses look to when they want to move to a state to start a business. One is a right to work issue. One is the educational system and the qualified workforce. Another one's the tax system, with the tax system probably weighing in as number one. We have a tax credit system that last budget year previously we approved, or actually we didn't approve. There was $600 million of tax credits. The bill that I filed would begin the dialogue, as I indicated in opening statements, so that the General Assembly would weigh in on that limit. Not the merit specifically of the programs, but we do need to look at the tax credits system, the programs, the return on investment, and the impact on our state's economy.
Mr. Talapi.
Thank you. I think I do have an answer on this one. My second takeaway point was all about the economy. The economy will boom if we make Missouri the medical mecca, where the regulatory environment is most tolerant, the most free market state in America to get or provide health care. Did you catch the recent national advertising campaign that New York ran? They're trying to get new business by giving away 10 years of taxes. And that's what states and even municipalities generally do to entice business. They give away tax revenue. I am not opposed to enterprise zones. We should make the entire state an enterprise zone. We can get business to start up in Missouri just by creating a friendly environment. We can take the lead in the domestic medical tourism business as soon as we want it. We will not become the Wild West of medicine. There will be a mountain of federal regulations. Healthcare continues to grow through good times and bad. It provides good jobs in many fields, and it's low pollution. It is an added benefit that Missourians will live in the state with the lowest healthcare costs in the nation.
We'll take one more question, and that one will be, what is your opinion of same-sex marriage for the state of Missouri?
In my opinion, the marriage is between a man and a woman, period.
The only fair thing to do is to grant the same rights and privileges to everyone. I believe the U.S. Supreme Court will decide a case by the general election in 2016 which will make same-sex marriage legal in all states. And if not, the Missouri legislature should put the issue back up for a vote, if only to get a measure of how the public feels then. 19 states now allow same-sex marriage. And this is one of those political hot potato issues. I think it was decided in 2004, I think. Voters voted against it like 71 to 29, but I think the tide has changed, and the legalization of marijuana, I think you put things on the ballot, let people voice their opinion, and people should be allowed to change their opinion from time to time.
I think equal rights should apply to all. I think if same-sex couples want to get married, they should be allowed to. I don't see that in any way as diminishing traditional marriage. I just think it's a matter of fairness. I think the general opinion on the issue has changed quite a bit in recent years, but we shouldn't pass laws based just on opinion. Sometimes we just should do what's right. And I think the right thing to do is to allow same-sex couples to get married if they so desire.
We'll now move to closing comments. Each candidate has 2 minutes to make closing comments. We'll begin with you, Mr. Gaines.
Okay, thank you. If elected to the House of Representatives, one of the first bills I would like to introduce would be to cut the size of the House. And this is no reflection on Kathy. That's not where I'm coming from. The state of Missouri has 163 state representatives. That's more than New York, that's more than California, that's more than Texas, that's more than almost all the other states in the union. I think half that many would be better. It would save a lot of money. It would make the House less cumbersome and more focused, in my opinion. And I think you could get some support for that, because with term limits, you're limited to only 8 years in the House anyway. And I think that would help us a lot. I have already mentioned that I have the time and the desire and the experience to be a good representative. But what I want to close with is the most important reason I want to be a representative is to help people. When I first got a position with a little bit of authority, I realized that one of the biggest advantages to having such a position is that you could help people. When I was a partner in an engineering firm, when I was a director with the Department of Natural Resources, regional director, when I was president of the school board, people could come to me and I actually had the authority and the ability to help them. And there's no better feeling in the world. I feel that when I volunteer at the hospitals, when I just move somebody in a wheelchair, it makes me feel good. And please understand, I'm not trying to make myself sound noble. I am not noble. But I have found that the best feeling in the world is helping others, and I would like to get in a position where I could do more to help others. Thank you.
Two people have been overwhelmingly influential in shaping my life, my mother and Dr. Helen Kinney. My mother, Maureen Integru, grew up poor in Laughlin, a tiny farming settlement in Bullinger County. With the nearest high school in Marble Hill, neither she nor her 3 brothers could attend. However, what she lacked in formal education, she overcame with conservative common sense and wisdom. She lived her Christian faith by example and believed that truth, integrity, and character were the fundamental values of a worthy life. For her, doing the right things was how she lived her life and how she expected me to live mine. In 1958, at the invitation of the governor of Missouri, Dr. Helen Kinney arrived at Southeast Missouri State College to establish a statewide pilot for nursing education. A very strict disciplinarian, she adamantly expected that her nurses meet her high standards. Properly administering medications, we were drilled with the 5 rights: the right patient, the right medication, the right dosage, the right route, the right time. She permanently impressed upon us that the lives of our patients were dependent on us doing things right. My core values are based on the teachings of these 2 remarkable women: do the right things and do things right. Do things right, study, research, weigh options, and take appropriate action. This summer alone, I willingly devoted countless hours working to save cottonwood, in addition to communicating with our city and county officials about the potential costs of sales tax exemption bills in our communities. Do the right things: character, integrity, courage, and the strength to stand firm regardless of political pressure. I'm confident in having the knowledge, skills, and the right values to do the right things for you, for all of us who live in this district. I pledge to continue to do the right things in representing you to the best of my ability. Thank you.
Thank you. My greatest strength is that I can look at the big picture and tell you where the money, and see where the money is going. In Missouri, the money is going to health care and education. The takeaway on health care is deregulate to the fullest extent possible. We may not be able to control what the federal government does, but we can put our own house in order. And let the other states fiddle with their tax credits to try to bring in business. We need to make Missouri the mecca for health care, the most free marketplace in America to get or provide medical care. Some states got to be the most free market state. Why not us? The opportunity is astounding. And to that end, besides resisting the lobbyists for the different medical practitioners and the not-for-profits who generally want their industries regulated, I'm specifically calling on the state legislature to begin the process of deregulation by getting rid of the CON, the Certificate of Need, a state regulation designed to keep people from building medical facilities. When you Google proportional representation, that thing I was talking about to make every vote count earlier, Google the Oklahoma Surgery Center and medical tourism too. This is a wave we need to catch, which brings it home to education. No one thinks it can happen, but I don't know what's so radical about charging people tuition on a means-tested basis, instead of having education consume every dollar that we raise from sales taxes at the state level and more. It's the most regressive tax there is. I have figured we can begin by cutting the sales tax at the state level by 1 cent the first year we start charging tuition without putting too big a pinch on parents. Good things will happen when we get hundreds of thousands of parents across the state invested in their children's education. Thank you all.
That concludes the questions. Let us all express our appreciation to 3 excellent candidates for this position. And now I turn the podium back to Ms. Miller.
And we want to thank, excuse me, thank you to everyone who came tonight. Thank you to the candidates and our other speakers. They gave us so much to think about. That is the purpose of our forums, is giving education to the voters. Then the voters will make the best decisions for having a good quality of life in our community. We want to thank Dr. Frank Nickel for being our moderator. Let's give him a round of applause, too. Thank you to KRCU and Dan Woods. They are our co-sponsors and have recorded the audio from the forum tonight. Thank you to Fred Lynch from the Southeast Missourian, and he's recorded the video and the audio from tonight. And if you go to the League of Women Voters webpage, we'll try to give you instructions on how to go to their web pages to check out the audio and the video. And our web page is lwvsemo.org. And then that will give the opportunity for people who couldn't come tonight to watch the forum or to listen to the forum. We know, especially because the congressional district is so large, covers so many counties in Missouri, that not everyone could come. But we are very pleased we have an opportunity for them to see it someplace else. And it also will be on the Cape Girardeau Public Access Television channel, which is 993 if you have cable television. We want to give a big thank you to Allison Davis from the concourse for letting us use the room tonight. It is a lovely room, and she was very generous with us. Also, thank you to all of our league members who worked tonight. They did a lot of work, and we very much appreciate that. So remember to make your voice heard and vote on Tuesday, November 4th. Thank you, and good night.